I'm Mike Cauley from the Florida Conference. It's Saturday night, January 23. Today I spoke at one of the churches in Orlando and had the privilege of attending the fellowship meal and hearing the stories of two Adventist doctors who were in Haiti this week meeting the needs of people. Dr. Ellie Kim and Dr. Jason Shives on Monday afternoon made their way to the Adventist hospital in Port-au-Prince. They reopened the hospital, the very first relief workers to get there, began seeing patients, doing surgeries, and assigning patients to other healthcare workers as they arrived. They also provided supplies and actually led out in the operation. The president of Haiti visited the hospital this week and said it was the most efficient and effective hospital in the country. I think you'd like to meet them. Here's their speech. Your most memorable experience, Ellie, from being in Haiti this past week.
Oh man, there's a lot that I just never forget. But one of them particularly was a young girl who I was treating. She had a lot of respiratory distress. We didn't know why. We didn't think she was going to make it. Some people thought it was tetanus. Some thought it was just ARDS, which is respiratory distress syndrome. We didn't know, and her breathing started to get shallower and shallower, and spacing apart more and more. We just thought she's just not going to make it. But overnight, I had taken a nap. I had gotten up. I thought she was just going to be passed away by then. But somebody had intubated her, and they were a bag masking her by hand. We don't have a ventilator, so the father was the only one there. I don't think she had a mother anymore. And I was heartbroken because the father had to sit there all night and bag her, manually ventilate her.
Keep his own daughter alive.
And they told me that he had, and when I went there in the morning, he wasn't there. I said, "Where's the father?" He was so tired because he stayed up all night. He was falling asleep as he was bagging her. And so he had to go, but they actually found her with nobody bagging her because that's the morning of the tremor, the 6.0 earthquake. Everyone ran out, and the patients were left there. Eventually, that morning, she
You saw a lot of death during this last week, and a lot of people who had amputations. Jason, what was your most memorable experience? I know it's hard to catalog it down to one thing.
I think the most memorable experience for me, if I had to pick one, would probably be going through that earthquake on Wednesday morning. I was thinking about whether or not to wake up or not. Actually, the search and rescue dog was in our room, and just a few minutes prior to the earthquake, we had been whining, and we were kind of upset with the dog for whining because it was waking us up. But then the dog knew that something was about to happen, and so it just kind of woke us all up. There was about 20 of us sleeping in a room, and the whole building started shaking. And so we got up, and we were trying to run, but we'd run, and then this, like the floor was going like this, and so some of us were falling over. And we finally made it outside, and it just, it went from being a medical trip to a medical experience. I was experiencing being a Haitian at that moment, being one of them, going through that. It's one thing to go and help someone after a disaster's happened, but you're in the disaster. It's continuing to happen, and it made it more real to me that, I'm this close to dying, losing a leg, losing an arm myself, and it helped me to really just, even though I was tired and worn out and cranky, I was able to really just empathize with the people that are going through.
Well, we really appreciate the ministry that you two men had, and it makes us grateful for Seventh-day Adventist Healthcare and for the vision that we have as a church that you doctors would give of your week and your time to serve people who really, really needed some help. God bless you. Thank you so much. Thank you for being here.